Intensive care units are reaching capacity in some areas of the country where the virus is surging. Not only are hospitals handling more people in the ICU, but critically ill patients are receiving treatment for longer periods of time. That type of care comes at a high cost. Patients, hospitals, and health insurers are facing enormous bills. Seth Denson joins us now from Dallas to break down the financial weight of ICU care during the pandemic. He's the co-founder and chief strategist of GDP Advisors. Seth, good to have you with us. So tell us, how are hospitals handling the cost of treating so many COVID-19 patients in the ICU?
Well, so far, cost really hasn't been an issue. The vast majority of those that are being treated have insurance, have health insurance, and certainly the hospitals are long prepared to bill insurance companies appropriately. And so while we are still seeing profits from the insurance markets, hospital systems have found a way to maintain cash flow as well throughout the pandemic. And not to mention that the PPP certainly has helped in some cases as well.
Well, the Wall Street Journal is reporting on one patient who spent 44 days in the hospital, 23 of those days in intensive care. The article is titled "The $1.9 Million COVID Patient." How does this happen, and ultimately who pays for these large types of bills?
Well, we, the American people, ultimately pay for that through health insurance premiums. Now, that being said, I think that the $1.9 million bill needs to be broken down a little bit. So there's the way that our healthcare system operates. It operates off of what's called billed charges. Now, it's very rare that an insurance company or a patient ever ends up paying billed charges. Billed charges are then negotiated through insurance contracts, typically to the tune of, in most cases, about half. And then that flows through to the insurance company, and then the patient then has their deductible or co-insurance responsibility. All that to say, this certainly does highlight what we've long stated, which is healthcare is a very expensive venture in the United States. And if we're going to work on something to solve, it's not necessarily health insurance premiums, as those are only the derivative of the very expensive healthcare system we have.
Medical experts say that high testing rates are essential to getting the pandemic under control. How does that testing factor into overall healthcare costs?
Well, the test is relatively inexpensive for the most part. I mean, tests are typically somewhere between $100 and $200. Now, this is where the system, so to speak, and maybe we'll call it a little bit of crony capitalism, finds its way, sadly, in some cases, where someone will get tested and then a lab will go ahead and run that test a multitude of ways in order to bill the insurance company for multiple tests. And we're seeing this happen more often. And that's a sad state of how our healthcare system works, where it is we have a fee-for-service system as opposed to an outcomes-based system, and this creates an opportunity for profit margins that sadly are not as under control as maybe we would like them to be.
So what should someone do if they receive a COVID test, are also tested for these other things, and then expect to have no bill but are faced with a sizable one?
That's a great question. And I think there's two things. First and foremost is be as proactive as possible. You need to treat any interaction with the healthcare system like you treat any other financial interaction. You should always ask, what am I really going to be billed in the end? Ask for a written statement of anything that you can have on the front end. Ask who's going to be processing the labs, and is everyone in network? Those are things we can do proactively. Reactively, whenever you get a bill, don't just assume you have to pay it as it's written. Most of these companies that are sending you these bills are expecting some level of negotiation. In reality, they're trying to get as much as they can out of the insurance company, and it's not uncommon for you to get them to be able to write off most, if not all of that bill, if you'll just call them.
Do you see the pandemic changing the way that Americans really think about healthcare and who pays for it?
I certainly hope so. If there's a silver lining, and it's hard to find any in this pandemic, it is that I think we as Americans are becoming more aware of the true cost and structure in which healthcare works. You know, it's a sixth of our U.S. economy, but it's the one area of our economic system where the consumer seems very disengaged. And that's in large part because the system operates under a veil of ambiguity. But the more that we can get the consumer to engage in healthcare, the more we can start to allow that consumer in our economic system to drive the market down, and that'll increase quality, encourage competition, and drive costs down. And so we need the American consumers to engage at a higher level, and my hope is that what this is doing is shining a light in some areas that we're certainly operating in the dark.
Well, one of the areas that certainly has had a light shown on it is the disparities in health care that's provided to folks here in the United States, particularly among socioeconomic classes and race. People, as you said, many of these people who have been hospitalized for a long time have health insurance and are covered. We also find that people who have no health insurance, oftentimes they're less worrisome. But it's that middle group, people who have a baseline level of health insurance, that might find themselves at a loss at how to pay some of these bills. What is your advice to those folks?
Well, recognize again that everything is negotiable if you'll try. And certainly there are programs out there to help people out that can't afford their deductibles. Most hospital systems will negotiate either a billing payment plan or even in some cases reduce the amount of the bill. But here's the positive note. There's been no reported situations where anyone has been denied access to care for the coronavirus as a result of not having adequate health insurance. This is certainly something that our healthcare community is rallying around to try to tackle. And at the end of the day, I think that most of the billing issues we're going to work on the back end. But certainly I would tell anybody in that situation, don't let your insurance or lack thereof be a barrier to entry into the healthcare system. But certainly be willing to engage on the back end and work to try to drive your costs down.
All right. Seth Denson, thank you for joining us.
Thank you.